And apart from health insurance, why do you think knowledge about financial management is important for doctors? And how and what are the instruments which doctors can invest in?
See, you're not, see, for up to 30 years, you are spending your time pursuing your knowledge. So from 30 to 40, you have to follow some senior colleagues and learn the basics and fundamental principles of practicing medicine. After 40 years only, a doctor from a middle class family in India starts seeing wealth. By the time they start seeing wealth, they are in their 40s or mid 40s. And when they become popular during 50s, some of them who become popular, they can make enough wealth. But a sense of a financial planning on how you are going to utilize your knowledge and resources to earn money, how you are able to multiply your wealth, all these sense should be your doctor should be exposed to all these things. Otherwise, all his knowledge to learn, to study, to master his art, and only work on hospitals. There are a lot of people are very intelligent, but they know only their home and their hospital and practice, and they are poor managers of their wealth. So naturally, with the amount of knowledge that any doctor has to do his specialty or super specialty, definitely if he spends some 5% of his time on knowing about the financial news, what is happening in the global economy, Indian economy, what is happening to a current GDP. The less than 1% of the GDP spent on health is resulting in more than 36% to spend on for the current epidemic during this pandemic. So we have not built a strong primary healthcare model. So what is deficient in our healthcare services? So how I can bridge the gap or make money to do an investment which can help my fellow citizens as well as to grow the healthcare status of our country. So if you have some financial wisdom, and when this combines with your medical knowledge, you can think of the healthcare requirement much better than a policy maker who has no medical knowledge. So naturally, people with medical knowledge, a small segment of them should carve a path and gain financial wisdom and become future policymakers in healthcare area. In the healthcare arena, what we need is people with medical background and some administrative knowledge and financial sense. This is very important. Ideally, insurance as a subject has to be included in the medical curriculum because in India, health insurance is growing very fast. Like in the Western world, tomorrow, most of the hospitals and most of the patients you treat are going to be covered under health insurance. And health insurance companies are going to govern the practices and patient safety goal norms in the hospitals. Health insurance companies are going to lay the guidelines for practices in the hospitals. If that is going to be the future, and if a practicing doctor is not aware of insurance and its noble objectives, then he is losing a lot. So as postgraduates, you all should, it's very good initiative, Dr. Venkatesh, that you have taken this subject. Because this is something which is not available in your textbook and where your college is not teaching you. So naturally, this is very important topic, and this is just a beginning. Every one of you should spend time to know about what is happening in this industry so that when the right opportunity comes, these knowledges can help in a bigger transformation and metamorphosis happening in your life. When the right opportunity comes, the knowledge that you are gaining these days by attending a webinar like this, definitely I can tell you, this can create a great metamorphosis. That day you can think about Prakash. Please give importance to such webinars, which is conducted, I should really appreciate the IMA junior wing under Dr. Venkatesh who has taken this initiative. These are very important and pertinent topics. Keep listening to this again and again and spend your time. You have the potential. You have the knowledge and wisdom. You are already a successful person. You are a doctor. You are the most qualified person, highly qualified person in this country. If you cannot do, no one can do. It is not your job just to complete your degree and make wealth only for you. Your knowledge and your wisdom should help in creating greater transformation in this country, transformation in the healthcare ecosystem in this country. It is possible, it is going to happen. And the people who are attending this forum, I'm very confident most of them have the potential to get into this transformation. And I'm really excited that your people could be able to think about this topic for a discussion in a webinar like this.
Thank you, sir. Thank you for your kind words, sir.